Hello and welcome. Today we bring you a delight. With us, we have Dr. Gagandeep Dhillon. Dr. Dhillon, welcome.
Hi, Dr. Kashyap. How are you today?
Fantastic. Thanks for being here today. Folks, we're bringing Dr. Dhillon here because he has recently published a very good article on LGBTQ toolkit for hospitals. So we'd like to congratulate you, Dr. Dhillon. Congratulations for publishing this article recently.
Thank you. Thank you for the congratulations. I think it took a lot of time and toil went into it, but I'm happy that the results were very positive, and we are trying to make an impact in the community and help the LGBTQ plus community as we go forward.
Absolutely. So before we go further, Dr. Dhillon, can you please quickly introduce yourself? I forgot Dr. Dhillon is a hospitalist, practicing hospitalist, and have some leadership roles as well. But let's hear from you, your introduction, Dr.
Hi, so my name is Dr. Gagandeep Dhillon. I'm one of the assistant medical directors at University of Maryland, Baltimore, Washington Medical Center with Adfinitas Health. I've been here now for around 9 months. Before that, I did my residency from Pennsylvania and worked in North Carolina for a good 6 years. And along with that, I also did my MBA last year from University of Tennessee, Knoxville, Physician Executive MBA. So that's like a snippet about me.
Absolutely fantastic. Let's dive in directly into your manuscript, what you have published as well. So can you provide let's say, layman's summary of this opinion article, and I'm just sharing it here with everybody to see it as well, very quickly for summary of the article.
So we basically came up with the gender inclusive care toolkit for hospitals. So this basically toolkit, it's a short commentary on how hospitals should basically approach LGBTQ plus patients. It aims to help healthcare providers in general to offer more equitable care to members of the LGBTQ plus community. So research that was used was featured earlier this month, as we know, in the Lancet Regional Health Americas. So that's where we are. So what we did was we had a kind of team with physicians from different parts of the country. There were hospitalists, there were radiologists, there were psychiatrists who played a very big role in this, nephrologists, there were even physicians from the sleep medicine team. So we all got together, and based on our experience, so we reviewed medical journals, we interviewed patients and providers also representing the LGBTQ plus community to understand how healthcare providers could better take care of the needs of these patients. Based on these findings, we got together and then we identified the areas of need where we need to work and came up with this toolkit.
Very good. Question for you is that what was a need for something like that? What was an immediate need? Something which you're planning, thinking for a while, or something was it became urgent and emergent?
It was something which was in the works for a while. I think most of us, or I can say a lot of us, do have friends and family members from the LGBTQ plus community. And if you go in the past, I think things are very different from where they were 20 years back. So I personally grew up in India. I did my medical school in Russia, and then I moved to the US. So I have basically understood the needs of this community and what problems they face in everyday life. Then there were other colleagues who worked in different settings. As I said, did have psychiatrists who see these patients on a more regular basis than some others. And based on that, we thought that we need to come up with something which would help these members of the LGBTQ plus community and maybe change even the landscape of how we practice medicine.
Sounds good. And I understand that it's an opinion article, just a start as well. Do you have any plans for follow-up study, probably using the data or collecting some data around it, or what would be your future direction from here?
So what our future direction right now is, this was initial early days, and I think I'm very thankful to the Lancet Regional Health Americas for giving us a chance to publish this article. So the future plan of action is I personally have already talked to the CMO of my organization, and we plan to distribute this study and hope to implement some of the ideas at our workplace. And I know for a fact that some of our other members who were a part of the article are planning to do the same. So what I personally plan to do is, and as I say, it's still early days, is maybe 6 months, a year, or 2 years down the line, we'll see how much change this has made in our practice, how much, if it has had a positive impact, which I'm sure it will, And then maybe, a year or 2 years down the line, we will come up with another study comparing what we've done, and then think of other ideas to see if there's anything else that can be done.
Fantastic. Let me change gears now. You're publishing a lot. In this year alone, you have published several articles on different topics. So what can you share with the physicians, nurses, doctors, medical students who are not delved into the research environment yet? What is your advice for those research novice or the people who have not done research yet?
I think it's one thing I would say, it's never too late to start. That's what I thought. I think in medicine, what happens is once you get into medicine, sometimes, if you're in the clinical side, it's sometimes we feel that, it's too late. I've gone through med school, residency, somehow you end up the fellowships, and now it's too late to start. So what I would say, the first thing is it's never too late to start. If you have a good mentor, like I had Dr. Kashyap, who's able to guide you through the process, I think things become a lot more easier. And again, if you are a physician, nurse, or even a professional in the healthcare field, you already do have the tools that you need to be successful at research. So I would say find yourself a good mentor, go into it with an open mind, and then I think sky is the limit.
Well, it's always a pleasure to interview a mentee and a colleague when they publish really good papers. So thank you. Let me ask you this question, which I ask all my interviewees, is that it's not research, it's a fun fact. So are you comfortable sharing a fun fact about yourself, which people would not guess otherwise, if you are okay sharing with our audience today?
Yeah, I think the fun fact, well, I'm not sure if it's a fun fact though, but I think because, we had a team of physicians who came together to come up with this toolkit, and some of them I knew beforehand, some of them I did not. And if I'm being honest with you, going by their initial impression, when I introduced this idea with them, I was a little apprehensive, thinking that, I'm not sure how they'll react to this, or, if they would even be interested. But I was so surprised that all of them, I can say every single person who's involved in this article and this commentary was 100% involved. And sometimes that's I think something we can learn from in this, that never judge a book by its cover. If you ever meet someone and maybe form an initial impression, that can change when you come to know that person. So that's something actually I learned while we were working on this commentary.
Perfect. Well, let me ask you a fun fact, the personal fun fact about you, your interest, food, I don't know what kind of thing as well. So do you have something to share from that angle?
I think food, I'm not too sure. I am someone, I don't live to eat, I eat to live. So, that kind of thing. So I'm basically, someone I'm very outdoorsy. I love playing soccer. Soccer is my passion. Like I follow a lot of English Premier League, and, just into regular stuff like running, exercise, and just being outdoors is my life. That's my passion in life.
All right, that's fantastic. Well, thank you so much, Dr. Dhillon, for being here today. I know it's a small step, but it's the right step in the direction that you can seek more information and hopefully provide more education and tools for our colleagues around the world, especially in America, for this marginalized community or any other community for that matter. So congratulations once again, and thanks for being here today.
Thank you. And thank you, Dr. Kashyap, for all your help, all your guidance with this. And I'm hoping it's a step in the right process. And as I said, we'll maybe get together again in the next year or two and think if we need a follow-up study to this.
Absolutely. We'll be happy to bring you back to our channel for further interviews.
Thank you for your time.
Yes.